Hello, I'm Dr. Randall Seacreast, your host for eOrthopod TV. And today we'll be talking with Sally Edwards. Miss Edwards is a patient who underwent a total hip replacement about 9 months ago. And she went through a procedure that allowed her to go home from the hospital the following morning. And today we're going to talk with her about sort of what led up to that. We're going to talk with her about what her experience was during that period of ramping up to undergo the total hip replacement, and then talk a little bit about the recovery and how that differed from what her expectations were. So thank you for joining us today, Ms. Edwards.
Certainly.
Can you start out by telling us a little bit about the activities that you felt that the hip pain was beginning to impact before you made this decision to have a total joint replacement?
You know, it was really interesting to me because what happened, I was on the tennis court. I had had no hip pain prior. I was in the middle of a match, and all of a sudden I had a very sharp pain in the middle of my right hip, in the front. And it sort of stopped me. I couldn't run for a shot. I go, what is that? And I thought, gosh, I must have strained something. So it took about 10 minutes and things got better, but it didn't go away. And then it kept recurring. So it was kind of not there, and then all of a sudden it was there.
And how long before you had the total hip replacement did you have this hip pain that started this way?
It's about 6 months.
Describe for me the problems you were having leading up to your hip replacement. What sort of symptoms were you having, and then how long did that occur before you finally realized that this was something you were going to have to consider a hip replacement for?
Well, it started abruptly with in the middle of a tennis match, as I said, and it was difficult to think that there was anything but a strain. So I thought, oh, I must have strained my hip. I'll rest it. And I rested probably for about 2 or 3 weeks, which is difficult because I was playing tennis at least 3 times a week, and I don't like to rest. So it didn't get better, and I thought, this is unusual because I usually heal pretty fast. I took some anti-inflammatories. I went to my primary care doctor, and we decided I should go to physical therapy. The physical therapist was wonderful, great physical therapist, but the therapy actually made it worse. I would go into therapy and come back to my office, and 2 hours later I could barely stand sitting. So that said, something else is going on here. I wonder what it is. And it was also bothering me at night. I would roll over in bed and my hip would hurt if I changed position. So it was really difficult to sleep. And I first went to a podiatrist because I thought I could see an asymmetry in my back. You know, one hip was higher than the other. He actually did leg length discrepancy and found that they were pretty close. There was a little bit of difference, but not enough to explain the hip pain that I had. He took an x-ray of my back and hip and said, looks like you have a little arthritis there, but we can't tell if that's what's really causing your hip pain or not. So at that point, I decided to go to an orthopedic surgeon. I went to Dr. Stickney, who not only did x-ray, but did an MRI and did an injection into the hip with some anesthetic at the time of the MRI scan, and it completely relieved the pain. It was gone. And that told him and me that it really was the hip that was giving the pain and the inside the joint.
Now, talk to me a little bit about the symptoms that you were experiencing, because I think when we talk about hip pain, a lot of people have different concepts of where that actually hurts or where you perceive the pain. Where did you perceive the pain? What did you feel like was actually hurting?
It was a very sharp pain in the, I'll say, medial aspect, because I'm a physician. So it was right in the middle of the groin, on the middle side. And that surprised me because I thought that hip pain should be on the side or even behind the hip. But it was very sharp and seemed to be positional. You know, so in some positions it didn't hurt at all. When I was standing, it didn't hurt. But if I sat or if I lay down and rolled over on my side, it was terrible. It was sharp, pinching. Ugh, it was terrible.
So this was mainly stuff or pain that hurt you when you did certain things. So it wasn't that dull aching pain into the knee or into the thigh that some people experience with degenerative hip disease.
Eventually, well, even from the very first, I had a difficult time using my right leg. It was my right hip that was affected. I couldn't go upstairs with my right leg. I had to, from that first moment when I was on the tennis court, when it started hurting, I had to go upstairs using only my left leg because it felt weak on my right leg. And eventually I did get an ache down into my leg, but that wasn't the first thing. It was sort of progressive.
Okay. And when you met with Dr. Stickney and began the diagnosis of the osteoarthritis of the hip and began planning what your treatment was going to be, what were your concerns at that point?
My major concern was I was planning to retire, and my plan for retirement was to play tennis 4 and 5 times a week, and I wanted to get back to tennis as soon as possible.
And Dr. Stickney felt like that if you had a hip replacement, a good hip replacement, that you could continue with that activity, which is a fairly high impact sport.
Yeah. Yes, that's absolutely correct. That was the goal. I knew that was the goal from the outset. He did too, and we both felt that we could accomplish that.
In terms of planning for your hip surgery, what sort of things that you felt like you needed to do prior to having this surgery did you focus on?
One thing was making sure that I had good insurance coverage because it's an expensive procedure, and I was planning to retire, so I had to make some choices in terms of what kind of coverage to have and when to do the surgery. So that all worked out well, but that was a concern. You have to make sure that you know what your coverage is. And then just the basics of rehabilitation afterwards. Where am I going to be in the house? How am I going to get around? What kind of equipment do I need? What kind of therapy am I going to need? That sort of thing. So it was mostly practical.
Now, had you planned to do this as an outpatient or a very short stay surgery, or was this something that was news to you when Dr. Stickney suggested you might be able to go home fairly quickly after surgery?
Well, actually, I'm a family practice physician, so I've had a fair number of patients who've had hip surgeries and knee surgeries, so I knew that it would require probably an overnight stay. But otherwise, I'm very healthy, and I figured it would be one night in the hospital.
And what about pain control? Were you at all concerned about whether your pain would be controlled at home once you left the hospital?
No, I knew that you can adequately control pain with oral medication, and I was sure that I wouldn't have a problem in terms of being able to do that.
So no anxieties there. I mean, a lot of patients, you've probably talked to patients of your own that are really concerned because this is a major operation, and pain control after a major operation like this tends to be a relatively large, anxiety-provoking sort of decision that patients have.
Yeah, I agree with that, and I think that with the medications that are oral that you can take at home, and the dosing, in terms of the frequency and making sure that you keep a level of pain medication that's continuous so that you don't get behind the pain, I was fairly confident that I would be comfortable enough to be able to sleep and move, which is really important after surgery. You have to be able to move.
And what about help at home? Were you concerned whether you would have the right type of help at home or adequate help at home to be able to recover? Any problems there?
No, my husband is wonderful. He's a great guy, and I knew that we could get through this just fine. And in fact, my sister is a physical therapist, and so I knew she could help me with how to do certain tasks. If I had an issue of getting, something done, she would be able to advise me about that.
Well, talk to me a little bit about your experience. So after you were ready to go into surgery, once you came into the hospital and prepared for surgery, can you sort of take it from there and tell me what your experience was during the procedure, immediately before the procedure, during the procedure, and then in the recovery room and moving towards going home to the hospital? Sort of describe what you remember about that experience.
Sure. I even think the pre-op experience was worth talking about too, because it was smooth, efficient. Everything went, as planned in terms of getting the right studies done beforehand, and doing it in a very time-efficient manner. When I got to the hospital, everyone is so kind. That was my major impression, from the admitting people to the nurses and the pre-op, and the nurses post-operative up in the floor. Everybody was so helpful and so kind. The pre-op was fine, where you're in the room with someone who's starting an IV and telling you what's going to be happening. They're always preparing you for the next step. So that was really reassuring, because I had never had a surgical procedure before. My mother's a surgical nurse, so I heard a lot about surgeries, but I had never been through one myself. And it was, I think, as good as it could possibly be in terms of actually going through the procedure. The anesthetic, fine. I didn't wake up at all during the procedure. Afterwards, I don't tolerate pain medications very well, so I had some nausea. I just don't like them very much. And the nurses were very helpful in terms of medications that help with the nausea. And the pain was adequately controlled. It's just the balance between how much pain medication can you tolerate and what side effects you get from it. But they were very good in terms of being helpful. So they got me up the same day. I had surgery in the morning, and they got me up at the bedside and took a few steps that very same day. And the hip felt stable. It hurt some, but it felt like things were properly aligned. It felt good.
And could you tell that it was not your own hip? A lot of people wonder whether it's going to feel completely foreign or whether it's going to just feel like it functions the way it should.
Felt normal. It just felt normal again. And to be able to move my leg across my other leg, so move it across without pain was a miracle. Beforehand, I couldn't even get my foot up to get my socks on because it hurt. And that was gone. That was a miracle. It was great.
Now, you mentioned you got up at the bedside the same day of surgery. Was that with a walker or crutches or just with assistance?
With a walker and a standby from a physical therapist. They have to make sure that you can get to the bathroom. That's huge in terms of being able to go home. You have to at least be able to do that. And so I got up to the bathroom, I think, that very same afternoon. And then I think I might have gotten up one more time that day. And then the next day, I got up, had pretty good pain control through the night. Yeah, the pain control wasn't the issue. It was really the nausea with the pain meds. So I decided I didn't want the strongest narcotic. I wanted the next level down because it just wouldn't make me as sick. And got up with the physical therapist that morning, the next morning, and went and started figuring out how to do stairs with her and doing them safely. She was very good. We walked down the hallway, went into a room, went upstairs, downstairs, because I do have stairs in my house, and that was an issue.
And when you went home, were you using a walker at home as well, or crutches, or any sort of support?
Walker mostly, downstairs on one floor. I had arranged that I was going to sleep downstairs. And that worked out fine, using a walker.
How long do you think you ended up using a walker to help get around in the house after surgery?
I would say no more than a week all the time, and about 2 weeks using it at night to get up and go to the bathroom.
Okay. And how long was it before you were able to go back to work?
I was retired, so I stayed at home, which was fortunate. It was when I retired about 6 weeks before my surgery, I didn't know I was going to get a hip replacement. That's how quickly things evolved. In terms of the workup, it was, oh, yes, this could fix your problem. Oh, well, that will help me get back to my tennis game. Let's go ahead and do it. So I didn't have to go back to work, which was fortunate for my practice and my partners. That worked out.
And what about getting back into a car and driving? How long was it before your doctor allowed you to get into a car and drive?
Dr. Stickney said 6 weeks. I saw him at 10 days and I was doing pretty well even by that time. And I think I probably drove 4 weeks because I wasn't really having pain. It wasn't hurting. At that point I was just taking Tylenol and getting around with a cane. I'm not even sure that at 4 weeks I was using a cane, because at 6 weeks I was starting back to hitting some tennis balls, not running a lot, but hitting some tennis balls. So I think I was not using a cane at that point at all.
Yeah, I think a lot of people are concerned about driving after a hip replacement or a knee replacement. And I think we as orthopedic surgeons tend to want to make sure that not so much that you're not having pain, you're not going to hurt the hip. It's really the reaction time. So we're worried about people being able to react, hit the brake, do the things they need to.
Right.
They're off medication so that they're not driving under the influence of any sort of narcotic or any type of medication that might change your ability to react. So I think that's a common confusion amongst people who think, well, I feel like I can do it. We as orthopedic surgeons tend to sort of be very conservative because we definitely don't want you to hurt what we've just fixed by having a car wreck, even a minor fender bender.
Right.
In terms of your tennis playing, how long was it before you actually got back on the court and played a game of tennis?
Yeah, as I remember, I started hitting a few balls 6 or 7 weeks after the surgery, and not moving a lot, but just hitting. And to actually run around and play a game was 3 months. To be really functional, 3 to 4 months. And the tennis pro that I take lessons from said my mobility is better than it was before my hip replacement.
And now, 9 months later, do you consider that hip functioning normally? Do you ever think about the fact that you have a hip replacement at this point?
I don't. I don't ever think about it. The only time is when I maybe put on a bathing suit and I see that little scar because it's an anterior hip replacement. As I understand it, that makes the healing time faster, and it was very easy to rehab, I think. It went very smoothly and very quickly. And now I think I'm playing better tennis than I ever did. So it's perfect. People at the tennis club ask me, how's your hip? I go, fine. I don't even think about it at all. Not at all.
If you had any suggestions for patients that are watching this, what would those be? What do you think that you would want to know as a patient before making this decision?
I think it's very important to get your understanding of what needs to be done and why it needs to be done first. So you talk with your orthopedic surgeon, look at the x-rays, decide, is it time? Is the pain bad enough? And when I talk to my friends or my patients, is it really interfering with your life? Is it making it so you can't do what you need to do? And if so, then it probably is time. Most of my patients had a hard time deciding, even when it was interfering with their life. They had questions about whether they wanted to do surgery or not. I think my situation was a little different because my mom was a surgical nurse and I knew all kinds of good outcomes of surgery, and so I was more willing to go ahead with it on a fairly quick basis. That was helpful for me. But I would say if it's really interfering with your life and you want to get on with your life, go ahead and do it.
Anything that you would recommend patients do beforehand that you would have done differently did you have it to do over again?
Exercise, get really strong beforehand. Lose weight if you need to, because it's harder on your joints if you're heavy. That's a tall order, I think, for a lot of patients and for me as well. So just keep that in mind, that it's much easier on your joints if you're not carrying extra weight. And then educate yourself ask your questions about what kind of hip, what the procedure will be, why the choice of that procedure, just, the basics that I was well informed beforehand. Dr. Stickney did a great job in terms of letting me know what was going to be happening and what we were doing, and I think most orthopedic surgeons would be.
Well, I think this has been an excellent discussion, and I think that patients are going to really appreciate this information that you can give both in some ways from a physician's perspective, a family physician's perspective, but also as a patient's perspective. So I want to thank you for joining us today.
Well, thank you very much. I was glad to do it.